So today we're going to start another important topic, which is cellulitis. So let's start. Bismillahirrahmanirrahim. So basically, cellulitis is actually the inflammation of the subcutaneous tissue, which is caused by group A beta hemolytic streptococci. The streptococci produce two type of enzymes, which is known as hyaluronidase and streptokinase. Okay. Hyaluronidase enzymes do basically break down the intracellular cement, which is actually by releasing the hyaluronic acid, facilitating the tissue invasion, and streptokinase actually promotes the fibrinolysis, helping the spread of infection through the facial planes. Okay, then the net result is that there is exudate spread in the subcutaneous and facial planes, resulting in a gross swelling that is actually affected. Loose subcutaneous tissue in scrotum and loose connective tissue in the intestinal tissue in face and forearm. The spread is very fast, means where the tissue is loose, the spread is very fast. Source of infection can be actually trauma, minor, major, crash or scratch, snake bite, scorpion bite, etc. Predisposing factors, two important factors are diabetes, low resistance of an individual. Then we have actually the common sites are lower limb, face and scrotum. The affected part shows actually redness, itching, diffuse swelling, and stretched and shiny. Patient has pain, fever and toxemia, and then follow later, means the patient is in the form of shock. It is differentiated from the abscess by many features. If this is not treated, so there will be suppuration and sludging and gangrene formation. Always remember that first you should stabilize the patient by resuscitate the patient, because the patient have fever, pain, okay, swelling. So first you have to stabilize the patient, then bed rest with legs elevated in order to reduce the edema. Glycerin, magnesium sulfate dressing is very important for the reduction in the edema, which has osmotic effect. If the patient has diabetes mellitus, so injection subcutaneously insulin is very important, and also antibiotic, which is very important. Intramuscular or intravenous penicillin should be given after 6 hourly for 5 to 7 days, and cephalosporins has also been given. For the insect bite, you can give anti-snake venom. The complications, the patient can have actually abscess if the condition is not treated, and it can also be necrotizing fasciitis, which can be caused by streptococcus pyogenes that can be gone extensively spread in the necrosis of tissues, skin, subcutaneous tissues, result in necrotizing fasciitis. It is treated by debridement or skin grafting. Then toxemia or septicemia is actually streptococcal toxic shock syndrome. Okay, this results with the exotoxins are produced by microorganisms. Cellulitis can precipitate also ketoacidosis, which can have in the patients of diabetes mellitus patient. Okay, in this patient you can do also investigation CBC in order to see the neutrophils and also the glucose level in diabetic patients. There is inflammation, so you can also see for the C-reactive protein and ESR. You can also do blood culture in order to find the bacteria, ultrasound Doppler to check the deep venous thrombosis, and X-ray for the gas gangrene to rule out. Renal function test is done for the before antibiotics administration. Okay, if the patient does not respond to antibiotics, then if there are signs of necrosis, blisters and crepitus, mean the patient can have possible gas gangrene, which is actually the underlying abscess suspected clinically or by imaging. Okay.